everyone, welcome to researchmd.com. We're going to teach you another important concept in infectious disease. All these concepts taken from the multiple board review materials. We use MixApp, could be USMLE World and all that. Okay, so again, my name is Dr. PRAMIL, and let's start. Okay, so first we have the clinical scenario right here. So when you look at it, we got a 26-year-old female present with a purulent vaginal discharge, history of multiple sexual partners. So what do we think? Some kind of sexually transmitted disease going on, right? You look at the labs, pretty much okay. You did a urine, except urine PCR, remember, positive gonorrhea, but no chlamydia, okay? So what is this? Talk about a little bit about organism in this sexually transmitted disease is Neisseria gonorrhea. It's a gram-negative, usually present. It could be cervicitis or urethritis, and then epididymitis, proctitis, and pharyngitis also. Okay. Now, disseminated gonococcal infection. That's very, very serious condition, right? So you can have a triad. What is a triad? You got polyarthritis, dermatitis, and tenosynovitis. Polyarthritis is migratory. Okay, and then or it could be purulent monoarthritis also. So usually what you can do is like you get the urine, you do this urine nucleic acid amplification test, which is actually you can order as like a urine PCR. The same, if somebody have like pharyngitis, you can do the pharyngeal swab also. Now, let's look back and see what questions can you expect. The board is going to ask how to treat it. That's what they need to know. They probably ask only about gonorrhea treatment. What is the treatment for gonorrhea? If you got an outpatient, patient come in, you should give IM ceftriaxone 500 milligram times 1, you're done. Okay? Now, so let's say the patient has penicillin allergy. What is going to recommend it? Penicillin allergy, like if there's no beta-lactam, that's still kind of, if there's a penicillin allergy and there's a beta-lactam allergy, then you should use gentamicin 240 milligram IM times 1 and give azithromycin. You can give like 2 gram PO. But that's more like clinical board. I don't think it's going to ask you, okay? So we talk about IM ceftriaxone. Now, let's say if you have chlamydia, we used to use azithromycin as the first time, as a first drug of choice, but a lot of resistance. So you may see like a new change. You wanted to use doxycycline 100 milligram twice a day for 7 days. That's like a recent new changes, okay? So remember that. In pregnancy, use azithromycin. Now, the question also is going to be about disseminated gonococcal infection. We talk about the triad, right? Synovitis, polyarthritis, dermatitis. So that's what the question is going to be. So yes, IV ceftriaxone. Okay, but don't pick any other. The IV ceftriaxone is a third generation cephalosporin. You got good gram-negative coverage also. That's why we use it for urinary tract infections, right? So, but if you see another cephalosporin, don't pick it. Usually the wrong answer, especially cefixime, like a lot of resistance, cefirixime. So it may not be, the right choice. Okay, so if you have to pick one cephalosporin, always pick IV ceftriaxone. So let's look back one more time. We're talking about gonococcal infection right here. Don't forget about the disseminated, that the clinical stem probably is going to talk about the gonococcal infection, disseminated. Okay, that will be and then look at the treatment, IM ceftriaxone, disseminated, also IV ceftriaxone, and do not pick the others cephalosporin, which is not very useful in this condition. Okay, thank you so much for watching. We'll be back with another presentation soon. God bless.